Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
I am Dr. Haresh Rajani, an ENT surgeon practicing in Chalisgaon since last 21 years. I am here to deliver a lecture on vertigo, understanding vertigo. Have you ever turned in bed, looked up suddenly, or stood up and felt like the whole room was spinning? If yes, then you are not alone. That spinning feeling is often called vertigo. And for many people, it can feel confusing, frightening, and deeply unsettling. Welcome to Steady Balance. This is episode number 1. Today, let us understand vertigo in simple words: what it is, why it happens, and what your body is trying to do to tell you. First one, the one important point: vertigo is not disease by itself. It is a symptom. In symptom terms, it is a false feeling that you or the world around you is moving, even when everything is actually stable and still. Some people describe it as a spinning, others describe it as swaying, tilting, or feeling of pulling to one side, and so on. It may also come with nausea, sweating, and unsteadiness, right? Reflecting symptoms or sudden fear because of you are not able to maintain the balance, and it feels no longer feels normal body. So how does the body normally keep us balanced? Your balance depends on three systems working together: your inner ear senses movement and your position of the body. Your eyes tell your brain what is happening around you, and your muscles and joints tell your brain where your body is in space. Your blends all of these signals together every second so you can understand, walk, turn, and move safely. When the signals match, you feel steady. When they don't match, the brain gets confused and it gets a wrong signal. So that confusion leads to the vertigo. That means spinning of the body. In many people, the problem starts in the inner ear. Inside the inner ear are tiny balance organs filled with fluid and delicate sensory cells, the semicircular canals. They help to detect the turning movement of the head. The utricle and saccule, which is a part of the inner ear, help to detect the straight line movement and gravity. When the system sends the wrong message, or when the message does not match what your eyes and body are sensing, the brain gets confused and it's a wrongly think that a movement is happening. That false message creates the spinning feeling of the move, vertigo. This is called spinning and vertiginous feeling. This mismatch can also cause nausea, vomiting, unsteadiness, and abnormal eye movements. And so, if the vertigo has ever made you feel frightened or helpless, please remember this: it is a real physical symptom. It is not imagined, and it should not be dismissed. One of the most common causes of vertigo is BPPV, that is paroxysmal positional vertigo. And the name sounds complicated, but the idea is simple. Tiny crystal in the inner ear can move out of the place. When that happens, rolling over in bed, bending down, or looking up can trigger the symptoms of vertigo and sudden spinning movement. The good news is that this type of vertigo is common and often treatable. Another cause is vestibular neuritis. This happens when the balance nerve becomes inflamed. Often it is after a viral illness, and maybe it comes from the nasal or allergic rhinitis kind of thing, and it goes to the inner ear nerve system. Result can be sudden severe vertigo, nausea, vomiting, and trouble walking steadily. Third cause is a Meniere's disease. In this condition, changes in the fluid balance inside the inner ear can interfere with the normal hearing and balance sign signals. So along with the vertigo, a person may also notice ringing in the ear, that is tinnitus, hearing loss, and or feeling of fullness of the pressure in the one ear on the affected side. It is also important to know that not all vertigo comes from the inner ear, but sometimes it can be related to the brain. For example, migraine, multiple sclerosis, or in some cases, stroke kind of thing. So that can be ruled out. That is why vertigo should not be ignored. If it comes with a warning signal like double vision, slurred speech, facial weakness, numbness, trouble walking, or a sudden severe headache, in that those situations, urgent medical attention is very important because it can be related to the brain issues. The good news is that many causes of vertigo can be treated. Some people improve with the simple head position maneuvers, and especially in BPPV, others may need medicines, balance exercises, and or treatment for the underlying cause. So the key message to remember is this: vertigo happens when the body's balance signals become mixed up, and the brain senses some movement that is not really happening. So it causes vertigo. And if you are someone you know is having repeated spinning episodes, falls, hearing changes, or severe symptoms, please do not ignore it. With the right evaluation, the cause of can often be understood, and treatment can help bringing confidence and balance back. So this is all about BPPV and differentiation between brain vertigo. That's it. Thank you very much.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.